And we are moving on to the final session of the day. And that is integrating laboratory services in primary care and diagnostic service optimization by Dr. Sudath Dharmaratne, Deputy Director General, Laboratory Services. And I cordially invite the chairperson, Dr. Dilip Liyanage, on stage, please. Consultant, Medical Administration. And also, I would like to invite Dr. Lalanta Senaratne to accompany Dr. Dilip Liyanage as co-chairperson for the session.
Very good afternoon. After a long day, I would like to call upon my teacher, Dr. Sudath Dharmaratne, for the last lecture. The topic is Diagnostic Facilities. Dr. Sudath Dharmaratne is a consultant in medical administration who served as a former secretary of Board of Study in medical administration in PGIM and director in healthcare quality and safety in 2019. He took the initiative in developing electronic database of laboratory equipment and reactivated the National Laboratory Advisory Committee. Moreover, he is the secretary to the National Advisory Committee of Biosafety and Biosecurity and also the National Advisory Committee for Combating Antimicrobial Resistance. Dr. Dharmaratne has been serving as an examiner and a trainer of MSc and MD in medical administration since 2012. He has won several national productivity and health excellence quality awards due to his remarkable contribution towards the health sector of Sri Lanka. Over to you, sir.
Good evening. Thank you, Dr. Dilip, for your kind words of introduction. So I am going to discuss contemporary laboratory diagnostic challenges. So laboratory sector is very important, crucial for any sector, maybe curative sector or preventive sector. You need laboratory testing. So to provide these laboratory services, there are laboratories in different levels. From the primary level care up to the tertiary care levels, there are laboratories are there. So we designate these laboratories as level 1 to level 4 laboratories. So we can very clearly see that there is a very clear advancement in technology and increase in skills, human resources, and there are a lot of wide range of testing done in higher level of laboratories. So level 1 laboratory, basically these laboratories are at primary medical care units. There are no laboratory MLTs are there. Their tests are usually done by point of care testing like glucometers and etc. Even yet they can provide basic diagnostic testing in relation to hematology as well as biochemistry. Level 2 laboratories are provided by the laboratories in divisional hospitals as well as base hospitals. Some divisional hospitals, they have at least one medical laboratory technology. So in a DEH, there is a laboratory with basic facilities are there. So these are we designate as level 2 laboratories. When it comes to level 3 laboratories, these are established in district general hospitals. And also laboratory consultants over there, from the base hospital upwards, there are laboratory consultants. At this stage, there are notable enhancement of both technology and infrastructure as well as human resources. There are a lot of MLDs are there working, laboratories are there working, and all the sections, hematology, chemical pathology, as well as microbiology, testing are done at level 3 level laboratories. And level 4 laboratories, basically at national and teaching hospitals level. In addition to above specialties, they are doing some maybe virology testing, etc., and genomic sequence facilities may be there at the level 4 laboratories. The wide range of testing are done at level 4 laboratories. So they need cutting edge technology as well as highly skilled human resource has to be deployed in that level of laboratories. So this is the importance of laboratories. Provision of laboratory service is essential component, as I mentioned earlier, because clinicians routinely rely on accurate laboratory results in their day-to-day practice. Investigation reports are important for accurate diagnosis of disease. For instance, the evaluated blood glucose testing facilities in a primary medical care unit will allow the medical officers to manage diabetic patients very effectively. And also some investigations are very also necessary to monitor the progression of diseases. For example, to available of inflammatory markers at the level 2 and also HB1 testing. These are very important to monitor the disease progression. So ensuring universal health coverage and strengthening primary care. This is, I think, main our concern today. This is a good thing. Some other things you have to, always patient should be there. But yet the laboratories, the advantage is the patient can be stay in their residences or at the lowest level, primary medical care unit level, the samples can be transported to the higher levels so that we can do the testing at the higher level laboratories and the report, send the report back to them. That is added advantage in relation to laboratory services. But in contrast to the other diagnostic services, for example, if they need radiology or something, your patient has to transfer. But laboratory, only sample can be transferred to the higher level of laboratories and get the results for the lower level of care. So therefore, strengthening appropriate laboratory facilities in primary care hospitals has become an integral part of the primary healthcare strengthening project. We know there's a project called PSSV project. Strengthening laboratory services in primary healthcare brings many benefits, such as reducing financial hardships to patients while contributing to the economic development of the country. And also early detection of diseases and preventing their complications will reduce considerable cost of expenditure. Therefore, expanding of the diagnostic services to the grassroots level of the healthcare will definitely strengthen the people-centered primary healthcare services in Sri Lanka. So this is the level I have, again, I'm illustrating these levels are there. The level 1 laboratories are there, level 2 laboratories are there, level 3 and level 4 laboratories are there. You can see, in terms of technology and human resource and range of testing, is increasing when you consider higher level of laboratories. This is also the same thing. Like, for example, the lowest level of care, divisional hospitals are there. So this is the point of care testing facilities. For example, glucometer. And there are no MLTs. So basic laboratory tests can be done, like blood sugar and serum creatinine. These are called feed-in hospitals. The next level of care, you have some analyzers. Analyzers in terms of technology, there are low-end analyzers are there. And there may be one or more to MLTs. And also laboratory test, the lower range and capacity is there. And these are called referral hospitals. So the hospitals, the PMC level, the samples can be sent to the referral hospital. And divisional hospitals also there. And base hospitals are basically, there are maybe some consultants as well. When it comes to level 3 laboratories, there are laboratory consultants in all 4 areas, microbiology, hematology, clinical pathology and pathology, with the wider range of capacity is there in terms of laboratory testing. And also, level 4 laboratories, national teaching laboratories are there. They do advanced laboratory and special tests like tumor markers and virology studies and so on and so forth. They can do wide range of testing. And National Reference Laboratory is the Medical Research Institute. They can do a lot of testing, including special tests. They are doing more than 350 tests at the Medical Research Institute. Another important thing I want to highlight, the clustering of laboratories. What's the importance of clustering the laboratory services? The laboratory services network takes one laboratory at a referral hospital, and that's several feed-in hospitals in the catchment area. We call as a one network cluster, within which primary care hospitals could benefit from laboratory services extended by the referral hospital. The number of these clusters and the locations will be depend on the capacity of the hospitals and also human resource and equipment at the laboratory as well as at the feeding hospitals. And enabling road network and conducive timetable public transport. For example, Dr. Dilip is the Provincial Director of Health Services earlier in Jaffna, the northern province, so he knows the road network structure. And what are the clusters? Maybe the Kais maybe have another cluster, Point Bay has another cluster. Like he knows as a Provincial Director what is the cluster map in the relevant Jaffna district. So it is different from the cluster map in the central province because their geographical terrain is different. Then another important is you have to, as I mentioned, you have to transport these specimens. So specimen referral transport system is very important. So diagnostic laboratory clustering involves grouping diagnostic laboratories based on various criteria such as types of tests they perform, the technologies they use, or overall diagnostic capabilities. Choosing the most appropriate transportation model for each network cluster is essential for good functioning of the network. If the specimens cannot be transported to the laboratory and the test results transferred back to the feeding hospital, test results in a reasonable period of time, if you cannot achieve that, the whole network fails. So you can see you have to referral should be made to the higher centers, the specimens with a good clinical history, the sample as properly you have to send the sample in a safe and secure manner, and also you have to get the report back to the end user client. It is crucial to select a suitable transport model that will work in a given conditions of each cluster. So different provinces may be different and district to district also may be different. The feasibility needs to be verified before starting laboratory establishing referral transport system. These are the models of transport. The one is picked up by the referral hospital. The referral hospital, they use some kind of courier system or transporter to collect sample from the primary medical care units and they will do. That is called pick up by referral hospital. Other method is bottom up. You can see the delivery by the PD hospitals. So small hospitals, they assign a transporter to deliver the sample to the higher level of referral laboratory. And there may be someone had the hybrid method as well because if as a regional director can decide, okay, this will work in that particular area, they can pick up by a referral hospital. But some other area may be delivered by the feeding hospital. So the both models can be used as a hybrid method as well. And I will describe about diagnostic network optimization. That's very essential because we have to consider the economic situation of the country. Therefore, we have to always implement cost-effective laboratory strategies. It is mandatory to implement these strategies at each and every level of the tier-specific diagnostic system of the country. Tier-specific, there are several tiers, there are several layers there. As I mentioned, level 1, level 2, level 3, level 4. Likewise, we have a primary medical care institute, then secondary level care, tertiary level care. So therefore, that is called tier-specific diagnostic network. Because we can't buy these analyzers and we can't keep these analyzers in each and every laboratory. Right? We can give high-end analysis only the higher level of hospitals. Right? Otherwise, they have to send the samples to the high level laboratory and get the test done at the high level. That is we call diagnostic, tier-specific diagnostic network. It is an exercise that aims to redesign a diagnostic network setup in order to increase access, maximize impact, and generate efficiencies. It aligns testing demand and capacity in the most cost-effective way by defining the optimal instrument mix, identify the most appropriate locations where instruments should be placed, and designing the referral network linkages across the revised network. So there should be a very good mix of optimal instruments. For example, in hematology, you have to think about whether you are seeing a 3-part analyzer or 5-part analyzer or 7-part analyzer. That depends on their requirement. These are some important factors if you want to establish the diagnostic network optimization. First thing you have to consider disease epidemiology. Our country, we are not it's not a deciding factor when you are procuring the laboratory equipment. You have to first think about what is the disease epidemiology. For example, where the dengue is common, why the analyses are needed for these areas to do platelet count. So consider the disease epidemiology also one of the important factor. when you are designing a diagnostic network. Then the structure of the health system we have to consider. Also private sector laboratories also there, and also government laboratories are there. So we have to think of the structure of the system. There are MOICs at the regional hospital, then there will be medical superintendents in the base hospital, and also administrative hierarchy, and the channel of communication, the structure of the health system also has a major consideration. And the types of tests are available in different levels. So these are another important factor you have to think about. And also the available transport networks. What is the mode of transport? What are the available networks? Are we using these samples through ambulance or by a courier, by a person, by a motorbike? So you have to think about how to send these samples. And other geographic factors also will affect the access to the patients even for the laboratory services. So design an effective system is therefore complex and highly context dependent, requiring a multitude of inputs and assumptions. So diagnostic network optimization is one particular valuable approach to help countries design efficient and cost-effective diagnostic network adapted to their own settings and priorities. So this is, I can illustrate in diagrams. So you can see the community settings, then the point of care testing are there, the lowest level primary care settings are there, then there are district level laboratories are there, regional laboratories are there, and also there's a national laboratories. This is a tier-specific diagnostic network. When it comes to diagnostic optimization, this is also, I am illustrating in this picture as well. You can see the same thing, primary care to district laboratories and provincial laboratories, and also national laboratory, where molecular testing also can be done in the higher level of laboratories. I am proud to say that during COVID pandemic, we have established genomic sequence facilities in 4 centers, 2 at Medical Research Institute as well as Karapeti and Kandy. So we have to, from the service distance, we have to send the specimens to the higher level of care. The time taken from this to get the results back, we call turnaround time. So we have to reduce the turnaround time. Another important thing is, if somebody asks what is the most important things you are as a DG laboratory service, I will tell one important thing is the quality of the laboratory testing. We have to have a very high, good, accurate quality laboratory testing. Number 2 is timeliness. We have to provide the testing results as early as possible to the treating clinicians. These are the most important consideration. In that context, Laboratory Division Ministry of Health has embarked upon several interventions. So as Dr. Dilip mentioned, the preparation laboratory equipment database is very important. We know what are the equipments available, whether they are functional or not functional, everything. We are now deciding how to optimize the laboratory network. And also, ensuring the quality of the laboratory test and also timeliness also of issuance test reports are paramount importance, as I mentioned again. And also quality, we are discussing quality, there are 2 things. One thing is you have to do some internal quality controls as well as you have to do some external quality assurance schemes. That's also another important criteria. Medical Research Institute is sending panels to other laboratories to engage in external quality assurance scheme. Establish a national laboratory information system with the funding support of the Health Information Quality Improvement Project. I think now we are on the process of developing national LIMS, so that everything can be entered and also the report also can be sent back to the clinician as far as we can. So we are now initiating this kind of activity. We are developing national laboratory information management system so that we can improve the timeliness as well as accuracy of results. So these are the challenges. What I see, these are the challenges. Now we are in a economic situation problem, so therefore funding, there may be lack of funding issues are there. And also, another important thing is when you decide to procure equipment, whatever things, you have to do a proper need analysis. Sometimes I have seen they are purchasing analyzers, but they don't have space to keep these analyzers. Ultimately, they are idling at the relevant hospitals. Sometimes they are purchasing analyzers, but there is no ML to do the things. So proper need analysis must be very important before purchasing equipment. And also it should be based on the test demand. For example, each machine has some kind of outputs. For example, if the test demand is low, why you are purchasing a high-end analyzer? No need. Right? That is why we always have to prioritize the equipment, whatever we're going to buy. There are so many list of equipment, so we have to prioritize as a team, including administrators, the biomedical engineers, the laboratory consultants, medical laboratory technologists. We as a team, we have to prioritize. Another important thing is procurement. Always procurement, there are a lot of delays. We don't know how to do a procurement. Always when you are doing procurement, there are pre-procurement activities, procurement activities as well as post-procurement activities. So that also we have to have a procurement time schedule, and we have to always abide with the procurement time schedule. You can't do procurements for years, right? The particular year you have to procure and complete the procurement. And also corrective and preventive maintenance is another important concerns. Every machine needs maintenance. When the machine is broken down, we need a repair. So that is corrective maintenance. And preventive maintenance before machine breaks down, you have to take proactive measure as a preventive maintenance. That is also another important area. And also, you have machines, you have people, you have everything, laboratory structure, everything is there. But if you don't get the reagents, then all will become to halt. Therefore, supply of uninterrupted reagents are very important. All the reagents are supplied basically, all the machines are basically, there are closed systems, you have to purchase locally. The relevant directors, you have to purchase locally. In the provinces, they purchase and they have to reimburse from the medical supplies division. If there are no budgets in the medical supplies division, ultimately, suppliers, they will stop the supply. There are supply chain disruptions. That is a big issue now because suppliers, if there are a lot of outstanding amounts, they won't provide the suppliers. Then we can't perform the testing. Another important thing is communication coordination gaps between hospital directors, the PDHs and RDHs and clinicians, laboratory consultants, MLDs, professional colleges, medical supplies division, NMRA, biomedical engineers, suppliers, and laboratory division, Ministry of Health. So we have to work as a team. So we have to have very close cordial relation with them. We have to build some relationships and have a teamwork, established teamwork when you are making decisions. That is, I think, very, very important to overcome these challenges. So these are basically a lot of challenges. So with that, I stop my presentation. If you have any questions, you can ask me. Thank you.
Are there any questions? You can ask any questions. Okay. And I must thank behalf of the Sri Lanka College of Specialist Family Physicians. I mean, having you here is an honor for us. Thank you very much for coming here and do your presentation because actually people, they do not know what's going on. We just request things. But anyway, we know the levels and how we have to request. Okay, thank you very much.
Well, thank you very much, sir, for that fruitful session. And I cordially invite the chairpersons to give away the token of appreciation to Dr. Sudath Dharmaratne, Dr. Dilip Lienage, and Dr. Lalantha Senaratne. Please pose for the group photo.